Across our country, hospital and hospital staff have been on the front lines of this battle to save lives during the pandemic. CTV's Avery Haines and W5 went inside one of those hospitals for an exclusive look at what is happening every day. And Avery is joining us this morning. Avery, good to see you. You know what? I thought I knew the battle that was being waged inside hospitals. I see the pictures on Instagram. I follow closely. I was shocked at the revelations from your stories. You spoke with staff working with COVID-19 at South Lake Regional Health Centre. This is in Newmarket in Ontario. What did you find?
I was shocked too. I was shocked by a number of things. I was surprised at how silent it is in a COVID ICU because the patients can't speak. Every single one of them is hooked up to a ventilator. I was surprised at the ages of the people I saw as I walked through the hallways in this unit. All of these men and women were behind negative pressure rooms. I was surprised to see a 31-year-old woman. I was surprised that the oldest person in there was 61 years old. I was surprised to see the staff, every single one of them without fail, welling up with tears at the battle that they are trying to help these patients through, and at the emotion that they felt as they had to turn off the ventilators, as they did twice when I was there.
At that hospital, Avery, there were 4 patients with COVID-19 in the ICU. 17 others were being treated in other wards. There are 21 cases in total at the hospital. Tell us about the risk that staff are facing, the specifics of it, treating those patients. We know that they're in close proximity, but tell us about the tasks they perform and the risk level involved.
Well, the thing is, and I think that's where the fear comes in, and that's where what surprised me. I mean, these are people who are used to dealing with death, right? I mean, they're used to being right in there, but they don't know. They don't know how to treat COVID-19, and so they're kind of running blind. They describe this level of exhaustion that you might feel, when you start a brand new job and you're just kind of learning on the day. That first day is really exhausting. They've been kind of having that first day on the job for now 2 months, and they have not had a surge. Their numbers are higher than what was on your board. They have 15 rooms in there. There were 9 COVID patients in there, all of them on ventilators on the days that we were in there. So they haven't had a surge that overwhelmed them, but they've developed this very interesting sharing system with other hospitals. So they will take patients, COVID patients, if other hospitals are surging, and they will send them when they're in that situation. And they were at the very beginning of COVID-19, the very beginning of this pandemic. They were overwhelmed and having to send patients elsewhere. But they're concerned about things opening up too soon and being put in a situation where they are overwhelmed, or where this wave becomes sort of more of a tsunami that we've been worried about.
Avery, I think this quote by Dr. Barry Nathanson, who's the critical care medical director there, he described it this way: we're building an airplane as we're flying it. Just speaks to the stress level that happens still every day. I want to thank you, Avery, for joining us this morning, and remind our viewers, COVID-19 Life and Death airs on Saturday at CTV, 8 o'clock Eastern, 5 p.m. Pacific. Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.